I love Brenda's acronym, and I would just like to add a P. So stabilization, housing, yes, Jordan, housing, intervention, and I would include early interventions for young people, for teenagers who are starting to experiment, who might not necessarily meet criteria for substance use disorders, but absolutely are displaying some risky behaviors. How can we do a course correction with them, as well as peers? But the P that I would add would be prevention. And that would be both school-based prevention, beginning in age kindergarten, using evidence-informed materials, talking to them about what does it mean to take medicine? How do you take medicine? Who should be giving you medicine? Well, it's a grown-up. Well, what does it mean to be a grown-up? Why is it dangerous or risky for you to take medicine that is not yours? Or to take it as a snack. That gummy vitamin might seem appealing because it's tasty, but guess what? That's a medicine, and that's a drug. Continuing that education to build protective factors about feeling good about yourself, setting goals, building peer supports so that looking to your peers for support and guidance isn't just a new concept if they do find themselves sideways, but building that in beginning in 3rd, 4th grade, conflict mediation, all of those kind of other side of the report card soft skills that are absolutely needed so that when people are facing an inability to cope with pain, physical, mental, somewhere in the middle, that they know how to respond to that, or they know when they need to reach out, because many times that's the thing that's most needed, is to reach out to somebody. So I would absolutely say reaching out and adding a second P, which is prevention. But that also, I mentioned school-based, that can also look like community prevention, which is using the strategic prevention framework, which is an evidence-based model, building in evaluation, as Lauren talked about, needs assessment, but then also meeting each community where they're at, pulling in faith-based communities, encouraging conversations early and often will help reduce forget stigma, it's prejudice that many times prevents people from getting help and continuing to seek that help. Ned used a wonderful analogy of the AIDS epidemic, and I would say that in addition to the increased accessibility of those medications, there was also a really large emphasis placed on safe sex and conversations with your partner, and what does contraception look like? And then also, how can we engage conversations where it is not taboo to say, did you bring a condom? I mean, those kinds of conversations are now more accessible because we've had a shift in mindset. So to be able to say to a physician, you know what, doc, I don't really think I need that medicine, thank you. For kids to know that they can push back and ask questions and determine their own health is pretty remarkable. So if we can teach kids beginning in kindergarten how to be strong-willed, yes, they do actually need those skills. We know that the data shows us that for every $1 invested in prevention, 18 are saved later downstream in treatment costs. It's not an either or, and I think that's something that all of us are kind of echoing, that none of this is an either or. It's a both and so how do we get downstream and save those people who are dying right now, but then also how do we get upstream and prevent 2 generations from now from going through something similar? Thank you.